Friday, December 18, 2020. This is episode 142. The COVID vaccine. How much is it really worth? It's a 39.6 Facebook and YouTube live finance show, the show that teaches high earners like yourselves how to make your money work for you so you don't have to work for your money. We talk general investing, taxes, real estate, syndications, Airbnb, paying for childcare, paying for college, and even the car you drive. It's COVID week, or vaccine week. I got my vaccine yesterday, shot number 1. My wife got hers today, shot number 1. Unbelievable amount of relief having gotten that, although we're definitely not in the clear yet, and even if you have a vaccine doesn't mean you're actually protected yet. Still have another dose in 3 weeks, and takes a little bit longer to get maximum benefit. However, in the Pfizer study, when they showed the curves, they didn't start to separate until about 7 days after the first one. So there's already some benefit after the first one, although I think it looks like it takes at least a week after the first one to have any benefit, at least the way I look at it. So I hope people who are getting vaccines aren't just going out and being reckless and then actually get the disease. But the vaccine, and this is a sticker that my toddler put on me, I just haven't taken off my hand. COVID vaccine, how much is it really worth? And this is something I've been thinking about, just because I like to think about things from a financial standpoint. And a lot of decisions politically are made one way or the other, and a lot of them are related to cost. I don't like to get into politics so much, but obviously the vaccine is a gigantic deal, and you can't just buy a vaccine and have it and then just sell it on eBay. Because if I could do that, if I could have not that I would have, but I could imagine people if they could get the vaccine and just pay whatever the sticker price is for it and then go eBay it, because most people can't actually get the vaccine, right? It's super rare. It's in very high demand. What would the free market actually pay for it? But the issue, you can't just sell something that has to be refrigerated at negative 70 Celsius, about almost negative 100 Fahrenheit. Although it only has to be that cold until you are basically going to use it. And then you have you still have some time and not as cold temperatures, but it doesn't last that long. The mRNA will degrade quickly, at least with the Pfizer vaccine. The Moderna vaccine is going to have a much longer shelf life, only require negative 20 Celsius. And that just got approved today, or at least recommended by the FDA for approval today. So that one's actually going to be in much more demand than the Pfizer vaccine, because a regular freezer can store it for 6 months, and then it'll actually last for 30 days in reasonable conditions. And it can be in room temperature for a long time, 10 hours or something, which makes it very, very reasonable for a lot of communities. Keeping something at negative 70 Celsius, most places don't even have freezers that go that cold. But let's pretend you could sell it. I wonder what people would pay. I was wondering what I would pay for it. I wasn't sure if I would be able to actually even safely get it, because I'm on inhaled steroids and I've been on it for multiple decades for my asthma. So I wasn't sure if it was contraindicated, because a lot of studies don't include people with various degrees of immunocompromise. But after multiple people told me just go ahead and get it and the benefits are worth the risk, so then I wanted to, and then I was like, how much would I pay? How much is my time worth and my life worth, my health worth? getting quarantined from work alone is unbelievably expensive. Like it cost me 5 figures to get quarantined. So that alone, just that one thing makes it super, super valuable. I mean, I probably would have paid 6 figures for a vaccine that's 95% effective. I mean, the value of, gosh, it's really hard to quantify how much it would actually be worth to me. Because if I got sick and, I could be out of work for a long time and I could much worse never work again. The cumulative value of that would be incredible. Now, the good thing is this is basically being subsidized by the government. So like when we got our vaccines, they didn't even check our insurance cards. We just got in the line. We had to register into the MyChart system. So they had our demographic information so they could track that we got it and give us an appointment for the follow-up. But they didn't even ask for our insurance information to bill us anything. Because I think technically you can bill like an administration charge for vaccines in general, right? In addition to the cost of the vaccine, although I think the actual cost of the vaccine is getting fronted by the government. I think you can still charge a nominal fee, which again, that fee is not even that much money. It's probably like $20 or something. And it drives me crazy when people think that doctors are just, this whole vaccine industry is made up to make profits for people in healthcare, and that's how doctors make a lot of money. Doctors don't make money on vaccines. If you're getting paid like $20 to administer a vaccine to somebody, and then you have to bill that to insurance, you have to fill out paperwork, put in a billing code, and then submit that to an insurance company who then rejects it, and you have to send it back to them, and then they decide, okay, now we'll pay for it like 90 days later after you've like gone back and forth with the insurance company to collect $20. It's not worth it. You've wasted so much of your resources to collect a tiny bill. Nobody gets wealthy off of vaccinations, at least not healthcare workers. Now, but then I was like, are the vaccine companies actually going to make any money on this? Because so the U.S. government put in like $12 billion into this deal, into Operation Warp Speed, which is a cool name, because this is unbelievable that they were able to sequence the virus, create multiple different vaccines, go through all these trials, and actually get months of randomized data before getting emergency use. And I have to end it to Pfizer BioNTech. I don't actually know how to say BioNTech, but maybe that's what it is. They didn't actually get any funding for development and manufacturing. They self-funded this. Okay, so you can see the breakdown of the cost. Like the government gave Johnson & Johnson $500 million for development. They gave Moderna $500 million, gave AstraZeneca Oxford $1.3 billion, Novavax $1.6 billion. Sorry, $1.2 billion for AstraZeneca, and then GlaxoSmithKline, Sanofi got $2 billion. That's just for the development manufacturing, okay? Not actually the manufacturing of the drug for the doses. So Pfizer, who was first to market to get the authorization, they self-developed it, and their $2 billion commitment, or $1.95 billion commitment, was dependent on, at least from what I read, dependent on them getting it FDA approved by December, and getting doses available. So let's see, the first batches are now being distributed per that. Actually, the approval came on December 11th. Pfizer vaccine, co-developed with the German biotech firm BioNTech, became the first in the U.S. to receive emergency use authorization from the FDA. First batches are being distributed per the July agreement. Yes. Blah, blah, blah. And then, okay, why the government did not secure more than 100 million doses? Because recipients need 2 doses spaced 3 weeks apart, enough to inoculate 50 million of the country's roughly 328 million residents. So this is also interesting. So from what I have heard, the people who are receiving it they are reserving 50% of the dose for the second one, which to me is like, why? We could be vaccinating twice as many people, but the problem is we can't get all those new vaccinations done in the next 3 weeks. So if you give those up to other people, they won't be available. Then basically all of the vaccines that were given could be not effective or only partially effective, like 57% or something. So you have to like literally just save them. But it would be amazing if this would be done in a rolling process. We just used up everything because you knew that there was always going to be some more coming in within 3 weeks, that you did not have to worry about saving the other half. But I think it is prudent to save that other half. Now, that $2 billion agreement with Pfizer BioNTech is for 100 million doses. So at $2 billion, it's only $20 a dose, actually $19.50 because it's 1.95 billion. $20 a dose, that's not very much money. If you think about how many pills, how many prescription medications can cost $20, I mean, my Symbicort inhaler is like $10 a day for inhalation. It's $250 an inhalation. I mean, there are a lot of pills that will run you. I mean, a chemotherapy pill could cost like $1,000 for like one pill. This is so valuable, and I hate to say it, but like compared to like one chemo pill, probably way more valuable than like one chemo pill in the grand scheme of most chemotherapies, because this is saving lots of lives. And not that chemotherapy doesn't, but one pill is only going to be a tiny portion of a chemotherapy dose. Okay. So $19.50 a dose, this is like the most valuable thing you could ever spend your money on. Okay. Because Pfizer, we didn't have to pay Pfizer to develop it. We're only paying Pfizer for the drug itself. And if it didn't work, they would have just lost all that money. But $19.50 for one shot. So for two shots, like $40, still unbelievably cheap. And then how much is that actually worth, let's say, in the whole population? So I had seen a couple different estimates, various different things about how much the value would be. And depending on if you're looking at severe or just any like infection, there were various ranges. But if you were looking at just severe infections, it was worth like $800 or something. But if you looked at, or maybe $400, but if you looked at like any infection, it was worth like $800. So it's like it was super, super cost effective because it's just a tiny portion of what it is actually worth. Okay. But let's talk about the worst outcome. Let's talk about deaths. Now, one of my biggest pet peeves about everything that people talk about is, well, the deaths are so low relative to the infection rate. Okay, but I mean, deaths are just one of the endpoints. There are so many different endpoints to look at. A lot of people get sick, and there's a lot of morbidity associated with being sick, financial morbidity and actual medical morbidity associated with being sick. And then there are the people who die who have gone through all these other morbidities prior to dying, and then you have to deal with the morbidity of the death with the family costs and whatnot. But what is the cost of an individual life? And it's morbid to think about this, but these questions have to be considered because otherwise governments wouldn't be able to decide how many it's worth to spend on something. But I've read various things. For example, in terms of what's something worth, the WHO often considers a treatment worth it if it gives you a 3 times basically a quality adjusted life year. So if the country's per capita GDP is 65,000, a treatment of about $200,000 for one good year of health would be worth it. Okay, so $200,000 per year. Okay, is one way to think about it. But in terms of just per person, their ranges can go as low as $10,000 up to like $1 million. Okay. So how much is one death worth, right? So that's many years potentially of life that are lost from one death. Now, people are going to say, well, people are going to die anyway. So if we look at the CDC data of actual raw deaths, the number of deaths per year, like per day, cumulative value, we're actually like $300,000 more, 300,000 people more than the average of the past 5 years. Okay, those are excess deaths. Now, from whatever they may be, those are the number of excess deaths. Okay, and right now, you look at the COVID death rate numbers, we're looking at 3,000 people. We actually were at 3,600 people died 2 days ago on my birthday, at least reported 3,600. That's the highest ever. That's in one day. Now, that's just COVID deaths. There are people that die every day in America, something like, I think somewhere around like 7,000 or 8,000. This is like 50% extra deaths. So think about, the hospital systems here. If you have 50% more people dying per day, that's how many more sick people you have in your hospital every day. Hospitals are already pretty occupied, and you just put a bolus of 50% more on top of what they're used to in terms of deaths, and easily much more than that just due to illness, using up all resources. It's crazy. But if you think about 3,000 people dying in one day, and let's just say you were to value a person's life at $1 million, and this is probably a low estimate for a lot of people. It depends on how old you are, but let's say the average person, 60 years old, and still has another 20 years at $50,000 a year, which is below the median, and that's already $1 million, right? So let's just take $1 million as an example, and you took 3,000 people in one day dying. 3,000 people times $1 million, that's $3 billion, okay, in that one day that is lost based on those deaths, okay? And that's just the deaths, the economic impact of the deaths. That's not including all the economic impact on healthcare society, everything else before that. Those are just the cost of those deaths is super expensive. That's just one day. If you have 1 month where you have 50,000 people die, 50,000 people times $1 million is $50 billion. Okay, and that's only using $1 million as a life value estimate. We can go way higher than that. If I were to quantify mathematically all of my future earnings and my future value today, like what I would be worth in terms of future production, gosh, it's 8 figures, 9 figures. So, it's incredible, right? This is why, this is so unbelievably valuable. It's interesting that the government's thrown in all of these resources, threw in 14 or 12 billion dollars, but you actually compare it to other expenses that the government has funded. For example, the average cost for natural disaster relief over the past 4 years, according to this, has actually been more. It's actually $13 billion opposed to 12.4. Now, granted, there's going to probably be a lot more money than this 12.4 billion, because I don't know if that 12.4 billion is going to pay for enough vaccines. It will depend on how many people get vaccinated. And I've heard about a lot of healthcare workers who have had access to the vaccine who have not gotten the vaccine, which blows me away. But if we can't even get healthcare workers to get vaccinated, I don't know how we're going to get anywhere near 70% of the whole population. But if we did get to 70% of the population, we're looking at about 220 million people would need to get it, approximately. 220 million times, let's just say $40 per person for 2 vaccines, you're looking about $8 billion just for the vaccines. The Moderna vaccines will be a little bit more expensive, maybe up to 50% more or so. But still, you need like $8 billion for all those vaccines. And some of those will be included in the 12 already done, but still is actually surprisingly not as big a cost compared to what it potentially could be, because the financial ramifications of this are unbelievable, right? Because this is just, and this is not even just here in America, this is international ramifications. Now, so that's only the $12 billion cost. Now the question to me was then, how are these vaccine companies actually gonna make money? Because to me, $20 a dose just doesn't really seem profitable. And a number of them are supposed to be selling them literally at no profit. And that's something that can potentially really be done when, you know, the government is giving you all this money for all the research and development, and then the actual part of the end is more cost-free, and it does open a lot of doors. Like a lot of these companies have other things, like Moderna has oncologic treatments, and that might be the future. And now these new mRNA viruses, this new technology, can spearhead this whole new area of medicine, which can generate other things. And I mean, oncologic drugs have gigantic profit margins, right? Vaccines, though, like $20 a dose, and you're only going to give 2 doses, there aren't really repeat customers, okay? Oncologics and like drugs for like neurological disorders where people are on the drug forever and they're crazy expensive drugs. I mean, there's super high margins on that, although the number of people is not necessarily as high. But cancer patients, there are a lot of cancer patients, big money, okay? There's really not that much money to be made in a vaccine where you're giving one person 2 doses for their entire lifetime, okay, at least as far as we know. You're making $40 of gross revenue per person. Now you have to then scale this to obviously to lots of people. I mean, you can't do this for a rare disease. You would never ever be able to be profitable. It has to be in something that gets to a lot of people. So that's where the scale comes in patients. So yeah, if you're doing 100 million doses at $20 a dose, then you have $2 billion. How much margin are they getting per dose? I don't know, because you still have to do all that, you know, transfer, super cold, all the handling costs. $20 just does not seem like that much money to me, but maybe there's $2 of profit of margin in there. Let's just say it's $2. Then, okay, $2 of margin on 100 million doses, that's $200 million. That's okay. That's not gonna move the needle very much for a company like Pfizer. I mean, if it's, let's say, $5 a margin, maybe $5 million, $500 million. Okay, that's. But I really don't. It's hard for me to really imagine they're getting $5 a margin. I don't know how much it actually is costing them. I'm sure like their cost per dose changes like by the day as they create more scaled production, and you know they get bigger, and you know they may acquire factories or are able to just do more doses at once and ship more doses together. Obviously, the bigger the volume, the cheaper it is per dose. But $20 a dose still seems so cheap to me. And then there's others that are supposed to be going to be even cheaper, like $4 a dose, assuming they actually pan out. And then we still are going to have to get them out to other countries, like developing nations, where $20 a dose is a lot. So maybe it's going to be cheaper for those countries. And so I don't really know. But there's no more valuable thing in medicine than this vaccine, because one dose or the 2 doses of this, I mean, it saves lives, it saves illness, it saves healthcare costs, saves so much, and it's just so unbelievably cheap. And the science is amazing, and it blows me away because people spend so much money like fundraising to find a cure for something that's not curable. Like, guess what? There's never going to be a cure for cancer. Like, you can't cure cancer. I don't care how much money you raise. Cancer is a type of a disease. It's like saying I want to cure infection. You can't cure infection because you can't remove every virus and bacteria in the universe, right? You can develop treatments for something, but then are you really curing it? The only cure is prevention. And that's exactly what a vaccine is. It's like the best possible thing you could have is prevention. And then people are like, oh, but I don't want that. So it's just mind-boggling to me that we can come so far in science to come up with the best possible treatment, which is prevention, at $40 to save unbelievable number of lives. Like, over 1 million people have died from this already. And people literally get offered the drug for the vaccine for free and refuse to take it, and they have no contraindication to do it because of other information that guides their judgment. So anyway, and then you have people like me where it's like, yeah, how much could I possibly pay? Like, how much would I bid on eBay to actually get this drug? Yeah, and there's people out there who would probably pay more than me. And I'm seeing people having protests in hospitals because the administrators in the hospitals are getting it before the frontline workers. Like, that's just unbelievable. That hospitals, I mean, I that's just, you know, what I heard or saw, but that actually could take place. It just blows me away. But hopefully soon enough, these will be available to everybody in the country within a few months. Hopefully every single healthcare worker and every single person who has an essential business, every public service employee, everybody who's out there and sees people on a daily basis that they don't live with, who wants to get it and can get it safely, should be able to get it. Hopefully that will come very soon. And then hopefully people actually take it. That's the one thing I'm the most not optimistic about, is what our actual penetrance will be with people getting the vaccine, when we don't even have all healthcare workers on board. But yeah, I can't really think of a price that would be too high to get it. So, all right, that's about it for COVID, the vaccine. Hopefully everybody out there who wants it can get it soon. And I am actually, I'm blown away by these companies who put in all this R&D, and really, I don't think they're making much money on this. This is really something for humanity. So that's awesome. Okay, that's it for episode 142. There's no financial advice in this at all. But as always, this is only for my entertainment. Hopefully a little bit of yours. Until tomorrow, we only have how many shopping days until Christmas? Like 4? Christmas Eve is a federal holiday this year too, so I don't know if that means anything. All right. Have a good night, everybody.